Is this the first place you want to know your numbers? Do you want to wait until you're being wheeled into the emergency room to find out you have high blood pressure or heart disease, high cholesterol, or even high blood sugar? Ignoring these danger signs can have serious, even deadly consequences. Heart disease is the #1 killer in our country for both men and women. The disease kills on average every 36 seconds. Men start getting heart disease 10 years before women. But when heart disease hits women, it hits hard. Women are more likely than men to die after a heart attack. Smoking increases the likelihood of developing heart disease. If you smoke, you are 2 to 4 times more likely to develop heart disease than your coworkers who don't smoke. I'm Kevin Florence, and I'll be your host to talk about some critical issues in healthcare today. The United States spends more dollars per capita on healthcare than any other country in the world. But the results of our excessive spending aren't that impressive. Our country ranks 16th out of 22 industrialized countries in health outcomes. We have lower life expectancy, and our infant mortality rate is the highest among these 22 other countries. We don't live as long as people do in Japan, France, Spain, Germany, and the United Kingdom, for example. Quality is a major problem in our healthcare system. We die from medical errors. We have a fragmented, inefficient system with unsustainable cost increases. Millions of Americans do not have health insurance. As one national healthcare expert put it, America's healthcare system costs too much and does too little. So with this dynamic backdrop, what is AutoNation, the nation's largest automotive retailer, doing? Recently, I sat down with Mike Maroney. Mike, thanks for joining us today. Mike, how serious is AutoNation about the health of its associates?
AutoNation is making a huge investment in its human assets. I'll explain in just a minute. Let me set the context for what we're facing. We cannot, as a company, control medical inflation in the United States. We cannot dictate the costs of primary care doctors and specialists. And we do not influence the surgical procedures nor the technology employed in hospitals and emergency rooms. Let's face it, if you or your loved one is undergoing a surgical procedure, you want only the best doctor, the best surgeon, the best surgical staff, and the best medicine.
Well, you're right, Mike. I know I only want the best for myself. So what can AutoNation do to address this issue?
What we can control is our use of healthcare. All of us, including AutoNation, can control those factors which precede that medical event. Those known risks which inevitably lead to using all these bests. And if we all act now, we collectively can avoid not only the pain, but the costs as well. So in a clear and direct way, we can control our medical cost future. AutoNation is committed to knowing its numbers and acting on this information. We are committed to engage every associate to take greater responsibility for his or her health. Right now, both AutoNation and our associates pay a flat % of the cost of health care. We don't want to change this approach because it's a win-win for both the company and associates when we can keep our costs down. Last year, we offered a health risk questionnaire through the University of Michigan. We wanted to encourage associates to participate, so we offered a $300 financial incentive to complete the online questionnaire. We will continue to offer the health risk questionnaire this year and a $300 financial incentive to complete it. You won't find many other companies willing to make that investment to promote health awareness. In fact, we're offering other financial incentives as well. New for 2008, we're offering financial incentives to encourage associates to get a routine physical exam and to get a blood screening so that they know what their health risks may be. Just as you pay attention to the gas gauge and the oil level in your vehicles, you should also pay attention to certain critical numbers about your body. We've added a financial incentive to encourage associates to enroll online. Another initiative is to provide a way for associates to find out their numbers. We plan to send mobile screening buses to every dealership to make this process easy and convenient. In fact, spouses can use this service as well. And another initiative involves changing our vending machine snack foods to provide a focus on healthy choices. What we're doing isn't typical for our industry at all. In fact, it's not typical for many Fortune 500 companies either. The elements of the strategy have been around for some time. However, we're unique in that we're combining all these initiatives together. We do not know of any other major employers who are tackling the health of their employees with the same magnitude and intensity as AutoNation is. AutoNation is making a bold investment in promoting healthy lifestyles for our associates. We believe that the initiatives discussed here are part of our corporate responsibility to our associates and that they will add to our competitive advantage. We value our associates and their health.
So Mike, how would you sum up what's the most important message you want employees to remember?
It's vitally important that you find out your health risks and then take action to minimize or reduce them. I can't emphasize it enough. You must know your numbers.
Thank you, Mike, for sharing the scope of AutoNation's innovative and aggressive actions. As Mike mentioned, AutoNation associates had the opportunity for the first time last year to take a confidential health risk questionnaire from the University of Michigan. In addition to the immediate feedback associates received after they took the health risk questionnaire, those employees who exhibited dangerous signs of impending health problems received a heart report from the University of Michigan. These associates were provided the opportunity to obtain health coaching with professional nurses. This same risk analysis showed that based on the sample, AutoNation associates exceed national norms in 4 chronic conditions: high blood pressure, heart disease, diabetes, and depression. That means you are 4 times more likely than national norms to have or develop any of these diseases. And based on this data, AutoNation employees have a higher health age. This means if you are 45 years old but have multiple health risks, your health age could be 62. Your lifestyle choices largely determine whether you will experience serious health problems down the road. You decide whether to smoke, exercise, eat properly, lose weight, and so on.
I think what AutoNation is doing about knowing your numbers is very important. I wish I had had the opportunity to take advantage of that before I had my stroke. I thought I knew my numbers, but clearly I did not.
Thanks, Phil, for talking with us. When you've been identified by the University of Michigan, or active health nurses or doctors, or your medical carrier as someone who may be at a high risk for serious medical conditions, help is available. If you are enrolled in the Blue Cross Blue Shield or Kelsey-Seybold medical coverage, the help is called the Dedicated Nurse Advisor Program. Even if you have not been identified as being at high risk, you can voluntarily call a dedicated nurse advisor. So what is a dedicated nurse advisor?
Maybe a best way to describe a nurse advisor is to compare ourselves to a trainer. We're going to train you and work with you so that you can take charge of your health. We can provide you with suggestions. We're going to provide you with encouragement. We want to support you and be your advocate as you work toward maintaining your health care. For instance, when you go to a doctor, he may only have a few minutes with you, and you may leave there not really understanding what the doctor said or wanting to ask questions. What does this lab test mean? What is it going to measure? Why did he prescribe that medication for me? All things that you don't want to bother your doctor with. But you can call your dedicated nurse advisor and ask those questions, and we'd be happy to help provide that information to you. The first telephone call that we make to an associate is a getting to know you session. It takes about 15, maybe 20 minutes. Basically, we'll lead you through a series of health questions to get a feel for what your health concerns are. And then we can devise an individualized care plan so that you can meet the optimum health care goals. I think one of the most important things we do is to help that person take charge of their health. We can provide you with education, with information, with skills, tips, hints, and a lot of encouragement. But our goal is for you to make those lifestyle changes, those positive health choices, and make that a permanent lifetime goal for yourself. Let me give you an example of how this program works.
Hello?
Hello, may I speak to Mr. Ron Ringstaff, please?
This is Ron.
Hi, Ron. This is Karen, your dedicated nurse advisor. How are you today?
Fine. How are you today, Karen?
Is this still a good time to talk?
The first time she called me, the call was probably about 20, 25 minutes. I was sort of surprised that somebody that I didn't know was calling and asking questions about my health. This is normally what you get in a doctor's office, not on the telephone. It's very important for us to know everything we can know about our health. Every month, she gives me that call and wants to know, how's my weight? How's your blood pressure? If I could give one message, I would say that do not take your health for granted.
You know, we've heard that your diet impacts your risk for health problems. Did you know the #1 snack people select from a vending machine when they're too busy to eat properly is a candy bar? 280 calories, 14 grams of fat, 5 grams of saturated fat, 5 milligrams of cholesterol, and 140 milligrams of sodium. Earlier when we talked with Mike Maroney, he mentioned changing the food selections in the vending machines as one of AutoNation's health awareness initiatives. The company plans to replace most of the snacks in the machines with more healthy choices. Let's talk with Lucille Besseler, who is a licensed dietitian and nutritionist. She knows how the food you eat impacts your health.
The way we help people the most is by helping them find foods that can improve their health or even manage their disease. For example, a diabetic needs to be eating a certain way to manage their blood sugars, and we teach them how to do that. The nutrition facts on the food label are very important. I don't know if a lot of people read the nutrition facts, but they should. It will help them choose a healthy snack. It is very important for us to consume snacks that have no trans fats and as little saturated fat as possible. Popcorn, fruit, and nuts. If you want a sweet snack, especially one that is going to satisfy that sweet craving, try dried fruits or fresh fruit. AutoNation is on the right track. There are only a handful of employers that take the health of their employees so seriously.
So what are these numbers everyone keeps referring to, and why are they so important to know? Medical research and evidence have shown these particular numbers are the highest predictive values of many major medical complications, especially from lifestyle choices. They are also the most treatable. If you know you're at risk and seek treatment, the complications associated with any treatment can be reduced or avoided. When you have high blood pressure, your heart has to work harder to pump blood, increasing your risk for a heart attack, stroke, and kidney failure. LDL, or bad cholesterol, can build up in your arteries and form plaque. That could clog your arteries. This could cause a heart attack or stroke. Triglycerides are a fat similar to cholesterol. When you eat, your body converts any calories it doesn't need to use right away into triglycerides. Later, hormones release triglycerides for energy between meals. If you regularly eat more calories than you burn, you may have high triglycerides. That contributes to hardening of the arteries or thickening of the artery walls, which increases your risk of a heart attack or stroke. Excess glucose or blood sugar can shrink and prematurely age your arteries, putting you at risk for a heart attack, stroke, diabetes, blindness, kidney failure, and even leg amputations. We've all heard the news that the rate of diabetes is increasing in our country. The size of your waist is linked to many illnesses, especially diabetes, heart failure, heart attack, and stroke.